Hope everyone's having a wonderful evening tonight. Wish I could be there with you, but very excited to share Bud's story, Mr. Pomeroy, and I'm glad we played a role in it. At the beginning of last year, we got a phone call. Mr. Pomeroy had esophageal cancer, and we knew he's in bad shape. After the phone call, we quickly set up an appointment. I try and get to know the esophageal cancer patients as soon as possible, and the appointment was at telehealth. And a lot of people think telehealth is kind of this remote, access where you don't get to know your patients that well. But it was amazing. I got to meet Bud, and his daughter was on every single phone call. She was literally his voice. He couldn't talk too much, was exhausted, winded. She would always have his grandson on her hip while we were talking, and it was nice because I felt like I got to build this really fantastic relationship with the family, which is key because the surgeries are intense. When I first met Bud in person, he was going through the process of chemotherapy and radiation. It takes about 5.5, 6 weeks to kind of get through that. And he wasn't doing well, but he was able to tolerate it and get optimized for surgery. And it's a really neat process we have now where patients can come from the East Coast or anywhere for that matter, and essentially get what takes sometimes weeks, which we call the staging workup, where they'll get a port for their chemotherapy, selective diagnostic screenings, usually an endoscopic ultrasound, feeding tube, a stent. We can even do imaging now. So really what takes weeks sometimes in the outpatient setting here at Tampa General, we can get done in 2 to 3 days. And then they can go back to, closer to home to get additional treatment if needed, and then return back to Tampa for what I like to call definitive surgical care, and in Bud's case, a big operation, an esophagectomy. The surgery itself was pretty intense. We usually will always try and start with a minimally invasive approach. We're one of the few centers, I think actually the only center that does a total robotic esophagectomy. I wish for Bud's sake he was a candidate for that. He wasn't. His disease was pretty advanced and required more aggressive intervention. Tampa General is a world-class teaching institute, so I work with fellows, residents, medical students, and for this operation usually takes me somewhere about between 5, 6, maybe even 7 hours, so it's all hands on deck. A lot of people in the operating room kind of helping me out, and I have a fantastic team I get to work with. And it's not just the operation. Sometimes these patients are in the hospital up to 2 weeks afterwards, and I tell the team, get your eagle eye ready. We're always looking for what could go wrong and trying to stay a day or two ahead of any complication. When Bud developed one of the post-op complications we actually fear, which is a leak from where we kind of hook the esophagus back up to the gastric pull-up or stomach, can be devastating. It can be life-threatening, and we use some new technology, and we actually built him a vacuum system that goes inside, which kind of collapses the defect and allows it to heal. It's pretty amazing stuff, and that's what you'll see in the photos where Bud's got some interesting tubes coming out of his nose. It's kind of a built-in vacuum system to allow his esophagus to heal. Bud had to undergo that, and he tolerated it like a champ. So from a teaching perspective, I look at every operation as an opportunity to teach the next generation. They're with me the entire time, and from just the perspective of the totality of what underwent his treatment, need a strong ICU team. We have that, and I'm grateful to have all the support to pull off operations such as Mr. Pomeroy underwent. I really feel like this East Coast, West Coast collaboration is looking at how do we take care of the state of Florida as best as possible. Not really this is my patient or your patient, but this is truly our patient. I think it's not just world-class care, it's world-class colleagues at this point. The physicians I've worked with on the East Coast are absolutely phenomenal. There's other cancer centers in Florida, but they don't have an ICU. They're not a level 1 trauma center. They're not equipped to take care of the really, really sick patients. And what you'll notice, even those cancer centers will send us their sick patients. Give us 10 years, we're the best cancer institute in the state of Florida, and we've got all this stuff right now to prove it. Oh, and hey guys, don't forget, April's Esophageal Cancer Awareness Month, so remember, we're all there to support patients like Bud and raise awareness about esophageal cancer. The best thing's to pick it up early with screening, so hopefully no one needs an esophagectomy.